and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Tom Bergman, one of our rural clinic providers. Hello, Tom.
Well, how's life today?
It's good. How are you?
I'm good. It's Friday, so that helps always.
True that. Today we're going to talk about mental health awareness because May is Mental Health Awareness Month. So just to start off with, can you talk a little bit about, I guess, kind of the general importance of our mental health?
Sure, yeah. So my name is Tom Bergman. I'm one of the PAs here. Mental health encompasses a lot. So some of the things that includes to be aware of would include anxiety disorders, panic disorders, OCD, depression, eating disorders, personality, psychotic disorder. I mean, there's a lot of things to consider, and it's important to take care of oneself. And if any of those things kind of hits close to home or bothers you functionally on any sort of a regular basis, you should get it addressed. And we can help facilitate, whether it be therapies or medications. We can help you pursue that through the hospital here. We have multiple outreach organizations that we go through, including Western Mental Health out of Marshall, and some teleservices as well, and they can help address any of these things with good effectiveness. And another kind of thing that I just wanted to touch on is it's important to not really sweep these things under the rug. Talk to any problems that you might have. Talk to your family and friends, and try to make it seem somewhat normal to have them addressed kind of as needed. It's important to address because if these things run rampant and control your life, it can actually reduce your lifespan. It can exacerbate other health problems, including blood pressure. It can worsen diabetes, increase the risk of heart attack, cause weight gain, memory issues, a whole kind of plethora of things. So your psychiatric health is very, very important.
And what would kind of some of the first steps be as far as if somebody's struggling with their mental health? Would that look like making an appointment with a provider here? Would that look like some other steps as far as maybe exercising, eating healthier, starting on medications, that sort of thing?
Yeah. Well, I think the first thing is we like people to make appointments here to kind of address that and talk about options. And obviously things that we would do through the clinic would be to consider medications. There's prescription medications for, there's a variety of those that are available for different conditions. And it's not always just, a one and done. There's a number of different meds, and you never really know which one's going to be the most effective for a said condition until you try something, and it takes some expert guidance to kind of walk you through it and kind of tell you what to expect. And it's a multi-step process, but that would be the beginnings of it. And whether therapy would be a consideration or not is kind of another discussion that a patient and provider would have. And like I tell people too, medications can be effective on their own. Therapy can be effective on its own, but both together are more effective than one or the other. So, and those are just conversations that folks could have with their primary care provider here.
Sure thing. And I guess if people are kind of concerned about bringing those mental health concerns to their primary care provider, or maybe even talking about them in general with people in their lives, do you have any suggestions or want to dispel any common myths about bringing those concerns to somebody's attention?
Yeah, I don't think anyone's ever real excited to bring that up or talk about it. It's something that I think people kind of have to to come to that conclusion themselves when they're ready. And if like I said before, if it's something that affects your life, whether it's sleep or other health problems, if there's physical manifestations of psychological issues, it's just nice to offer some recognition for that. And that's what the May month recognition is for, is to consider that and realize that there's treatments for it. And sometimes those things don't just go away on their own. Ignoring them is not an effective strategy necessarily. And it's generally better to try to treat these things as early as possible, as opposed to letting them get away from you. And sometimes it can be a lifelong ordeal, and if you can kind of head it off sooner than later, I mean, that's what I would certainly suggest.
For sure. And would you have any other recommendations as we go through Mental Health Awareness Month, or any suggestions that MCMC could assist people with before we wrap up?
Well, I think just in general, mental health is important, and I think I've talked about exercise in the past, but it seems like in general we don't do enough of it. And our bodies are made to move, and it's important to do that. It helps us sleep, it helps with a lot of things, and having a good diet as well, that kind of is hand in hand with exercise. And those are things that you can kind of take control of on your own, and try to have some accountability for. I think that's beneficial. And yeah, I mean, if there's any concerns in this ballpark, it's easy enough to make an appointment here, and any of the providers here are well versed in this kind of strategy, and we'd love to help anybody.
Sounds good, and thank you for joining us today, Tom.
Great to be here.
And if you'd like to make an appointment either for telehealth, psychotherapy services, or outreach services here at MCMC via Western Mental Health Providers, we will link those phone numbers and website links in the episode description.